I'm going to give you instructions. When we are downstairs in a lab, tomorrow you will be dissecting. You're going to start with an inanimate model to give you opportunity to practice on a foam that has hairs in it, and it will give you opportunity to learn how to work under the microscope, develop the hand-eye coordination, develop the kind of concept of slivering and dissection, and then we are going to give you a tissue. When you get the tissue, you're going to start with slivers, because the slivers are easier. Let me just see, I'm going to move into sliver. Slivers are easier to start with, because what you have to do is you're going to take a forceps with no teeth, and then you're going to line up your blade. You look for the follicular units where they exit the skin. That gives you an idea is there's a space in between this follicular unit and that follicular unit, so that's, I know I have to follow the path from there to the bottom to the bulb. So I look at this hair to the bottom, this hair to the bottom. I position my blade in between. I create so you notice I rotated my blade so I can kind of cut away from the follicular unit. I make a straight cut. I slightly rock my blade, and that's 1/4 hair, actually it's even bigger follicular unit. So I'm going to trim this. Once again, I'm going to position my blade away from the follicular unit. I'm seeing what I need to trim away. I trim that away, and this is my graft. So trim. I'm going to put this aside because this one has a little bit of transection on the top, so I'm going to talk about that later. Then I'm going to do another one. I position my blade. I go straight down. I hold the tip, the tissue by epidermis. I rotate. I trim. Fewer cuts, the better. This is going to be 1 hair graft, and then I continue. As you notice, I work from the left to right. If I start from this side, my hands are going to obstruct the view, so I need to see where I'm going. So that will be for graft dissection. The idea is to keep everything intact. For slivering, we get a piece of tissue. The hairs usually point away from me so that I can have a better view. I use a forceps with teeth. I grab the tip, and then I start sliding my blade. So what I do is I slide my blade between the follicular units on the top, and then I follow the hair follicles to the bottom, to the bulb, and slightly open the area as if it's like pages of the book. And then I work my way through. And as I do that, I'm looking at the follicular units on the left, follicular units on the right, and then sometimes I need to push with the blade to create a space, but the objective is to create a single follicular unit sliver. So the sliver that has only 1 row of follicular units, and then the other objective is to keep them always intact, and the third objective is to keep them moist. If you look at the side of this strip, there's transection here. I don't know if you can see. So follicular unit that is intact has all the shaft intact from the surface to the bulb. Transected hairs, they're missing here on the top, and this one misses the hair on the bottom. Can you see that? Slivering will continue until we have a single row of follicular units. Cadaver tissue sometimes is either too firm, or sometimes you can't see the follicular units well. However, once you master this skill, and if you brought surgical assistants, they're going to have a lot of time in it to work on different tissue. Once you finish that, and you master cadaver tissue, then any other tissue they encounter in an office will be much easier. Because if I have, if I have 2 needles to secure, so when I'm slivering, I'm using, and this is a single row of follicular units. So if I put only 1 needle, when I'm slivering and I'm creating a traction, the tissue rotates. The other thing, there is a tendency to pull the tissue closer to me when I'm slivering, as if I want to see better. So the idea is to create a traction that is away from these needles. That way it stabilizes the tissue and allows better precision. And this is what the follicular unit, the sliver should look like. And I forgot to spray it, but this is, it needs to be, by this time it should be sprayed and kept moist. Anything else? No.